Hi, my name is Alshaunti, and today I'll be demonstrating a nasogastric tube removal. In this video, I'll be talking about the purpose, the risk and benefits, patient teaching, patient monitoring, and at the end, I'll be performing a demonstration. The purpose of removing an NG tube is to safely discontinue the tube when the patient no longer needs it for feeding, medication administration, or gastric decompression. Removing the tube improves comfort and allows the patient to return to normal swallowing and breathing. For risks and benefits, some of the benefits include increased patient comfort, reduced risk of nasal skin breakdown and infection, and the ability to resume oral intake if approved. Some of the risks include gagging or coughing during removal, nosebleed or irritation of the nasal mucosa, vomiting, aspiration if the patient is unable to protect their airway, or in rare cases, the tube tearing or the tube is damaged. For patient teaching, before removing the NG tube, I would educate the patient by saying, this procedure will be quick. You may feel some pulling or mild discomfort. When I tell you, I'll ask you to take a deep breath or hold it in, whatever feels comfortable to you, and this will help protect your airway. Your eyes may water or you may cough a little, and that's normal. Please let me know if you feel any pain or you need to take a break. After removing the tube, I would tell the patient that your throat may feel a little irritated, but you may sip water or use some ice chips if allowed. Tell me if you feel nausea, trouble swallowing, or breathing difficulty. For patient monitoring, before removing the NG tube, I would verify the provided order, check for bowel sounds, assess the patient for abdominal distension, nausea, or vomiting, ensure that the patient is alert and able to follow commands. Then I would confirm that the tube feeding and medication administration has been discontinued. After removing the NG tube, I would assess the patient's breathing in their airway, check for any nosebleeds or pain, monitor the patient for nausea or discomfort. Then I would reassess the abdomen for bowel sounds. Then I would document the procedure, patient's response, and the teaching I provided. So I'm going to be demonstrating my NG tube removal. Supplies are very limited, but we are going to try to work with what we have. So this charger cord represents the NG tube. So the first step I would take is perform hand hygiene, which I've already done. The second step would be to position the patient into high fowlers or just sit them up. My next step would be to pause and disconnect all feeding and medication administration. Then I would flush with air, which I've already completed. Then my next step would be to prepare the patient. So I am going to be removing your NG tube, and I just like you to stay calm and take a deep breath and hold it in. This will help to close your airway during removal. So I'm going to remove the tape. Okay, now that the tape is removed, I'm going to remove your NG tube. So at the count of 3, take a deep breath and hold. 1, 2, 3. Now I'm assessing the patient for any nasal bleeding or signs of respiratory distress or discomfort. Then I will coil up the NG tube and dispose of it, and my final step would be to perform hand hygiene and document the patient's procedure, the tolerance, and my assessments. This concludes my NG tube demonstration. Thank you for watching.